In a groundbreaking scientific experiment, scientists have created a mice from two same-sex parents. Yes, you heard it right. This was done using a technique known as CRISPR-Cas9 gene editing technique using the stem cells of the mice. Although this technique is much harder in two male same-sex parents as compared to two female same-sex parents. Still, it creates a hope for the human same-sex reproduction which goes beyond the binaries of sperms and eggs. Yes, there still is the hope, but it might have multiple complexities when we replicate such models in human beings. You must have seen this news about a trans man getting pregnant. Transgender pregnancy is very new in India. You know, if a trans man undergoes cryopreservation, especially either the oocyte cryopreservation or embryo cryopreservation, and discontinue his testosterone therapy for some time, then yes, there is a possibility that pregnancy can be established. Gender affirmative therapies like gonadectomy, including removal of testes and ovaries, as well as gender affirmative hormone therapies, might be very useful in elevating the gender dysphoria. However, do you know, such therapies might also result in lack of reproductive potential and fertility issues in transgender and other gender diverse individuals. Approximately 50 to 58% of transgender individuals has a desire to plan a baby, very similar to any cisgender individual. However, studies shows that only 9 to 3% of transgender individuals or LGBTQIA population are really able to undergo the fertility preservation procedures. World Professional Association of Transgender Health, that is WPATH, along with the Endocrine Society and American Society for Reproductive Medicine, suggests and recommends that before starting the hormone therapy or surgery, the patient or the client must be counseled about the fertility preservation procedures. There are two major goals of gender affirmative hormone therapy. Firstly, the hormones given in the body reduce the effects of endogenous hormones which impact the secondary sexual characteristics of the sex assigned at birth. And the second major goal of hormone therapy is to increase the level of exogenous hormones in the body which affirm the gender identity of an individual. In transgender women, the gender affirmative hormone therapies consist of giving of anti-androgens with conjugation of estrogen. So anti-androgen, what they do is that they reduce the endogenous testosterone levels, while estrogen gives the full feminine effect. So the most common anti-androgen used is spironolactone, and it is used to inhibit the binding of testosterone, also the secretion of androgens in the trans woman's body. Researchers show that prolonged estrogen exposure on the testicular tissue is associated with testicle damage. It is also associated with reduction in the sperm production and may impact the Leydig cells of testes. In case of trans men, testosterone is the key hormone which impacts on the organs to induce the secondary sexual characteristics which are masculine in nature, like beard growth, deepening of voice, and muscle mass increase. Testosterone exposure has known effects on ovarian tissues. Even one of the key hormones known as anti-Mullerian hormone, which is a key reservoir for ovaries and ovum, that is also highly impacted due to androgenic therapy in trans men. Testosterone might also has impact on uterine endometrium as well as monthly cycles. This might also result in the impact on the implantation of the embryo on the uterine walls, which hampers the pregnancy. The best option for transgender women for fertility preservation is the use of cryopreservation of sperms before initiating the hormone therapy or before the gender affirmative surgeries. What is cryopreservation? Do you know? Cryopreservation is actually cooling of cells and tissues to sub-zero temperature, mostly in liquid nitrogen, in order to preserve them and sustain their biological activities so that we can use them in the future. You might be wondering, what if I have started with my gender affirmative hormone therapy? Can still being a transgender woman, I can go for cryopreservation of my sperms? So that is a good news for you. You can consult your doctor and they might guide you that even after starting the hormone therapy, the sperms can be preserved while we have to stop the hormones for some time. But do remember that the prolonged impact of estrogen might affect your reproductive potential. So a proper registered medical practitioner should be consulted for the cryopreservation techniques even after starting the hormone therapies. Doctor may recommend techniques like masturbation, penile vibratory stimulation, or electroejaculation to obtain the sperm samples. Such techniques might be very disheartening for the transgender women, as it might be very traumatic because of the gender dysphoria. But don't worry, there is one more method. Sometimes doctor also retrieve the sperms during gender affirmative surgeries directly from the testes or epididymis, but that method is infrequently used because it is invasive in nature. Excellent quality of sperms might be used for intrauterine insemination, in which the sperms are directly deposited into the uterus of the partner using a catheter during the ovulation process. But we really need at least 10 million motile sperms for IUI to get succeed. In contrast, the sperms of limited or poor quantity might be used for in vitro fertilization, IVF, with intracytoplasmic sperm injections. Testicular tissue cryopreservation as well as uterine implantation in non-transgender women might also be a good reproductive option for LGBTQIA plus community. But these researches are still at a very nascent stage. For transgender men, 3 of the main techniques for reproductive potential or fertility preservation are oocyte cryopreservation, embryo cryopreservation, and third one is ovarian tissue cryopreservation. But all these techniques are highly invasive in nature. We have to use gonadotropin releasing hormone to stimulate the ovaries for follicular release, and later we have to retrieve the ovarian tissues and oocytes, and it at least takes 2 weeks to proceed for these techniques. Research shows that there are 2 key factors for the IVF to get succeed. First is the number of oocytes preserved, and the second is the age when the oocytes were preserved. So it has been proved that at least there might be a chance of 70 to 80% of the pregnancy to succeed if the oocytes are preserved before the 38 years of age, maybe 35 in case of Indian population, and also if the number of oocytes reserved are at least 15 to 20 in number under the liquid nitrogen. Embryo cryopreservation is one of the reliable techniques to get an assured pregnancy at times. But the main question is where to get the sperm from to make it an embryo. Hence, it has multiple ethical, religious, or legal challenges based on your location. If a trans man really want to undergo oocyte cryopreservation or embryo cryopreservation, they might have to stop their androgen therapy for time being. Such stoppage in gender affirmative hormone therapy may have a negative mental health impact on the health of trans men individuals. Unfortunately, assisted reproductive technologies are highly expensive in nature, and everyone might not be able to undergo cryopreservation or other fertility preservation techniques. At times, these procedures are also not covered under the insurance acts or insurance companies. And you really have to undergo pelvic examinations at times. The multiple pelvic examination might be very traumatic for a transgender man. So at last, I would say 2 key points over here. First is that the mental health counseling from an educated counselor must be made compulsory, along with the support from a multidisciplinary team of doctors and healthcare providers, as well as the legal experts for transgender and other members of the LGBTQIA community for fertility preservation options consideration. And the second thing is that every LGBTQIA plus individual, if want to start a gender affirmative hormone therapy, they must be given a counseling and recommendation for cryopreservation techniques as recommended by the International WPATH guidelines.